Well, good evening, listeners of your award-winning national radio show, Let's Talk America, with host Shayna Thornton. Of course, I am Shayna, and I am the on-air host and executive producer for this a very diverse platform. And I'm so excited tonight to have a regular on our program back with us, talking about another new topic that's going to educate, motivate, and inspire. I'm talking about the one and only internist, Dr. Ken Redcross. Dr. Redcross, welcome back to Let's Talk America Radio.
Thank you for having me on, Shane. I'm so happy to be back. I always love being on your show, so thank you.
Thank you. You educate all of us, and we get so much positive feedback when you're on our program. Tonight, we're going to talk about sugars being out of control for diabetics, and we're going to talk about that emerging number of pre-diabetics here in the United States as well, talking about some solutions to perhaps help reverse that if it's possible. We're talking to a board certified internist tonight, again, Dr. Redcross. So super excited and elated with joy to have him on. Now, Dr. Redcross, you've been on Real Talk, the video edition of Let's Talk America Radio before. And I know your CV, I know your resume. You are the bomb.com. You're super, super smart and successful. But one of the things we like to dig into when we have our exclusive guests that are advocates and experts like yourself, we love the behind the scenes story. So in 2 minutes or less, tell us your story. Why focus on the things that you do? You really talk about the relationship, the rapport between the medical provider and the patient. Why is that so important to you?
Look, that's incredibly important. Look, I've been in practice for over 2 decades now, Shana, and one thing I've seen is healthcare has kind of become a little bit more focused on volume than value. Value to all of you listening and watching at this point. And so it was then I understood that my passion was really this patient-doctor bond. And over these few years, I've been able to really cultivate a nice practice around it, whether it's in office or whether we're talking, to make sure that there's 4 things you focus on: trust, respect, empathy, and communication between you and your doctor in order to get the best healthcare outcomes.
So important. I have read your book, but I did want to mention it as well. Of course, Bond, the 4 cornerstones of a lasting and caring relationship with your doctor. So thank you so much for really displaying that that is possible, because so many people do have concerns about that. I want to dive right into diabetes and high blood sugar, but I want to first touch on what you just talked about. When individuals are diabetic or pre-diabetic, we're concerned about diabetes because mom, dad, and grandparents were, like so many Americans that I know. They often will say, well, I have these issues, but they seem to be hesitant, Dr. Redcross, about expressing these concerns to their provider. What's, from your own medical background, what's behind that?
Yeah, Shana, especially in our community, and that we're so used to hearing about diabetes, we almost think like it's just something that's going to happen. It's like a rite of passage, but it isn't. And so I tell all my diabetics, let's recognize it's not your fault and it's not your fate. And that's also for some of the pre-diabetics out there who get a little nervous. So don't be afraid to go to your doctor because you think you're going to get bad news. Go there so that we can prevent some of these things. And that's why it's even more important that you have that relationship with the doctor, to be able to have that ability to be able to get to him or her when you start to think about some of these symptoms that we'll touch on tonight.
Yeah. As a health reporter, one of the things that concerns me is that so many times there's the opportunity to have the solution or things to help manage a disease or a health condition, and people are missing out on it because of hesitancy or distrust of saying, well, when I go to the doctor, all he or she's going to do is put me on yet another pill. And let's be real, you're a physician. Obviously, health is very important to you. I don't think, as a journalist, I don't think people aren't interested in living longer. Dr. Redcross, I think they find it difficult. I think there's something when one more pill is added on, it does something to them psychologically. Help.
It does. So look, let's go back. So the whole goal should be, and especially that I always talk about, my whole goal is not to have to pull out my prescription pad. We can heal a lot of different ways that do not require that. Now, make sure that we have that longevity of living life, but Shana, we want to live it healthy, right? We don't want to have issues and challenges and that sort of thing. So you want to have what's called a better health span. And we can do that, but we have to take charge of our healthcare. And shows like this, Shana, I'm so grateful for, because it allows us to do just that, or talk about these important topics.
Yeah. Thank you. And talking about it, and also empowerment, right? I mean, So many great health advocates like yourself say it's your health because you're a great physician, Dr. Redcross. But I've got to care too, right? I've got to be the
Yeah.
one that's actually going to follow the health guidelines you're sharing with me to make a difference.
Remember, it's a partnership, right? Look, so I'm the doctor, I trained all these years and so forth, but I'm not doing any of this without you. I'm not doing any of that without all of us with all these four walls in this room. I can't heal you unless you allow me to heal you for us to do this. But Shayna, it's a partnership. It's not one of these here. It's like this, eye to eye.
Yeah. Yeah, such a great point. I want to go into those who have been already diagnosed with diabetes. And for our pre-diabetics or those that are
Yeah.
concerned, we're going to certainly address you in a matter of minutes. But
Yeah.
and I know so many diabetics, when the sugar is out of control, out of whack, I notice they seem to be exhausted or they're
Yeah.
tired.
Yeah.
And Dr. Redcross, am I wrong to say this? But it seems to almost be a symptom even before the official diagnosis. Sometimes is that possible?
No, you hit the nail right on the head. Look, the reason why we're talking about this during the holiday seasons when there's a lot of sugar. So we're going to really understand and investigate our relationship with sugar. So one of the bigger signs and symptoms you get, you're right, Shayna, fatigue. Fatigue is the big one, but you know, it's so funny because it's non-specific. Sometimes we blow that off. We blow off fatigue as I'm just working hard and so forth. But like you said, that
Correct.
can be a first symptom of elevated blood sugar or diabetes. So you
Yeah.
need to make sure that you speak up.
Yeah. I mean, it's such a great point because I think a lot of times people do sort of pinpoint it on something else, right? I'm exhausted. I'm stressed, perhaps.
Yep.
I've been doing so much. I'm multitasking, but it
Right.
is so important that they know that. Tell us this when it comes to people saying, well, I know my body, I know when I'm exhausted. But for that diabetic that's already been diagnosed and perhaps living with it for years, is it a possibility they can almost become jaded and not really pay attention to new onset of symptoms that may creep up because of the sugar creeping up?
Look, that's a good point. And you're right. So we mentioned one of the non-specific ones being that of fatigue, but I also want everyone to think of a couple of more. Increased urination, increased thirst. Why would that happen, Shayna? Well, if you're running around and your blood sugar is elevated, it's going down to the bladder at some point to be released or excreted. And water flows with that. Body's fluids follow with that. And the whole point is that you get thirsty and you also end up realizing that I just don't feel myself. I'm urinating all day. So you don't blow these symptoms off. You really need to wake up and say, Dr. Redcross mentioned this, and these things aren't necessarily normal for me. Let me get on the phone with my doctor and go in and do something simple like just get a blood sugar test.
Yeah, something that is so simple. When you talked about increased urination or trips to the bathroom, I think so many people, there are different reasons why they may say
Yep,
that's happening. Um,
exactly.
I think for some women, obviously they could think urinary tract infection, right?
Exactly.
But
Exactly.
for men, right? I know something you are a huge advocate about
Yep.
for all men, but especially African American men,
Yep.
prostate cancer awareness or knowing that PSA. Explain.
Absolutely. So look, everyone. So especially when you get to a certain age, all of us as men are going to have some challenges with urinating properly. But I don't want you to blow that off because you can't always put it on just your prostate. Yes, I'm a huge advocate for
Mhm.
prostate health, but you also need to once again dial it in. We're talking about these signs and symptoms to almost in a sense prevent or early diagnose diabetes. So don't blow it off on a prostate issue.
Yeah.
Recognize it could be something as simple as your sugar is elevated and early, and we can really make a difference in this if we really have this discussion.
Yeah, and that's so key. And of course, Shane and Dr. Redcross having it, but more importantly, for me or whoever to have that with their own personal provider to get to the bottom of it. And that's so key. I know you mentioned frequent urination and glucose going throughout the body, but is there a connection perhaps with kidney impairment and uncontrolled blood sugars in a diabetic?
Yeah, and that's the dangerous part, right? With diabetes, we always think of the big things. Look, Shayna, we're talking about elevated blood sugar tonight, but it's not only about diabetes, it's about heart health, it's
That's
about
right.
brain health,
That's
it's
right.
about kidney health, it's about eye health, because we have these big blood vessels that go to the heart and go to the brain, but we have these little small minuscule ones that go to the
Correct.
kidneys that get damaged big time by blood sugar.
Yeah.
So that's why we're having this discussion. Number one, we're having it because we want to get those 96 million Americans who don't know that their sugar is elevated. And then we also want to corral those people who have diabetes to see what we can do to make things a bit better.
Yeah, so key. I have a great friend, health advocate, that always says, "What's your why?" right? And the why is I want to prevent the stroke, the heart attack, the
There we
kidney
go.
failure, because I want to be here for my kids or my
Love it.
godkids or my grandkids. And that's so important. We had an ophthalmologist on a few months ago, and she shared some fascinating news. She was saying it's so important to make sure you get the eyes checked as well, because she's saying a lot of times she's giving them hints to go see an internist because she believed diabetes was creeping up because of the blood vessels in the eyes. I mean, so what you're saying is it's really a holistic approach to a patient. It's not saying, well, it's just my blood sugar, it's just me running to the
That's
restroom.
right. That's
It's
right.
affecting, impacting vision in a negative way.
It is. And it's not only the blood vessels, everyone. Think about this. When we talk about those fluid shifts, I mentioned the fluid shifts when you have too much sugar in your bladder and you're
Yeah.
urinating all the time. Well, it causes the lens of the eye to go back and forth. That's why the blurred vision kind of comes and goes as well. So it's not only the blood vessel, but it's what it does to the lens of the eye. And we're seeing these little small microorganisms or micro vessels be damaged.
Yes. And of course, the best way to get to that is to visit an optometrist or ophthalmologist, of course, to get that addressed as soon as possible, because sight is so important, right? And so many eye experts have come on this program saying you've got to address it earlier. You can lose your sight.
Not only that, you can get to your family doc or your internal medicine doc, and we can look in the back of the eye as well and
Okay.
see some things that don't belong. So don't be turned off by saying, oh my gosh, I'm not going to be able to get to see this
Yeah.
specialist. You absolutely can. Your good primary care doctor can make sure they look in the back of the eye and see if there's anything going on.
Such a great point. For those diabetics that are watching us, they're very familiar with the terms A1C, fasting blood sugar.
Yep.
But for those that are maybe have been pre-diagnosed or tapped on the shoulder by a great internist like Dr. Redcross and saying, your sugar's going up, be very, very careful. Dad's a diabetic. Explain exactly what A1C is and fasting blood sugar for our newbies that are watching. And also, what's the difference? And is it important to know both numbers?
It is. Well, there's different reasons to know them. So if you're going in for a first diagnosis, we get a fasting blood sugar. If it's 126 or higher, it's a diabetic diagnosis. If you are not fasting and you go in and you've happened to have eaten and it's over 200, that's also a diagnosis. Now, let's say we already know you have diabetes. That's where the
Okay.
hemoglobin A1C can really come in, even though you can use it ahead of time too. But the A1C helps us know what is your blood sugar over a 3-month
I
interval.
see.
It kind of allows us to look under the hood of that car, that convertible that all of us are convertibles in my eyes, these beautiful convertibles. And you look under there, you want to see what's going on under the hood. The A1C helps you see that so you can see what's been going on for the past 3 months. That's why that is such an important number.
And the official diagnosis will come from the A1C or the fasting blood sugar.
It typically is a fasting blood sugar and at times a random blood sugar. In other words, someone comes in, doesn't know they have that diabetes or elevated blood sugar. They come in and it's 250, diagnosis is made.
I see.
So it kind of depends. But if you go in and you really say, I need to know today, like you out there listening, you want to
Yes,
go and get that fasting blood sugar.
blood sugar. Is there a possibility, Dr. Redcross, in your years of experience of treating diabetics, that they can have a normal under 126 fasting blood sugar, but the A1C is out of whack?
No, they correlate very, very well.
I see.
It's God's grace. It's incredible of how they correlate. I can look at certain A1Cs and say your blood sugar is kind of running around 200s.
I
So
see.
that's the beauty of being able. But once again, everyone, it's us talking about this tonight
Yeah.
and getting educated about the importance of this A1C, the blood sugar, some of the things that we can do to really make a difference should your blood sugar be elevated too.
And for our already diagnosed diabetics out there, I know I have ones in my family, and they continue to check their fasting glucose as well, and go see their internist every 3 to 6 months, depending on
Yep.
what's going on.
Yep.
But it is important for them, even when they're on medication that's controlling it, for them to still be aware of their fasting glucose
Well,
levels.
it is. Well, it's important to be not necessarily fasting, but you want to know kind of at one point in time, what does your sugar really look like? Because it gives you a lot of information into things that are in your diet that are affecting that you may not know. And those are some of the things we should definitely touch upon because when you're dealing with whether you're undiagnosed or you're one of the people we're talking about with elevated blood sugars or
Yeah.
diabetics, you need to make sure you stay on top of that diet and also exercise.